Hi, I'm Erin, and I have been a ketamine patient since 2021, and I am a patient here at Andala, and I come here for my maintenance treatments.
Exciting. All right, nice to meet you, Erin.
Nice to meet you.
What got you started with ketamine? How has this kind of helped you?
Well, I have had treatment-resistant depression and PTSD, complex PTSD, for quite a while. So I've keep up on my research on developments in technology for treatment, and when they started doing a lot of like psychedelic type studies and things like that, I got really interested, and so I found ketamine treatment through that, and it has been life-changing, honestly. I joke with my friends that it's like a hard reset for my brain. Like it's the equivalent of like turning it off and turning it back on again.
Unplug, replug. That's what I do for everything. I'm like, when in doubt, unplug, replug.
Yeah, exactly.
So exciting. Yeah. So it kind of just helps with like those everyday aspects of life, of just the mood stabilization.
Yeah. I feel like I can get my systems feel overwhelmed sometimes, and doing that reset kind of wipes the slate clean, and I can start over.
Yeah, good. I'm glad that it helps you.
Yeah.
Okay. So then maybe what is something that you kind of had thought of ketamine before, or that you had heard of ketamine before you started, that now that you have started it has kind of changed?
Well, I think that probably the biggest thing that I thought was that it was like a street drug, that it was something that people use like for like parties and like whatnot. So and so I was a little bit scared of like, okay, what's gonna happen to me? But the experience is really smooth. It's definitely, I'm assuming, probably not the same dosage that you would do like at a party or something, but and it's very well controlled, and I've never had an issue where I felt unsafe or scared or anything like that. So it's been great.
Okay, perfect. Let's see, what else? What are some other things? So how ketamine's helped you, how you kind of got started in it, maybe. I'm trying to think, like, what are some of the other like main things? What does ketamine feel like to you?
It feels like, for me specifically, I think it's different for everybody, but to me, it's like I can view my thoughts and my memories kind of from above, and then I can kind of drop down into it, and it's like I can fully look at the experience like as an outside party. It's not me. You know, with PTSD, you have a lot of flashbacks and things like that. It's completely different from a flashback. I'm there, but it's not me. Like it's a third.
It kind of
almost like an out-of-body experience, but it takes like my feelings out of it. I can just observe what's happening.
Okay.
Yeah.
That's exciting. Okay. What else?
Why here?
Huh?
Why here? Why here instead of?
Yeah. So what made you come to Andala Med Spa?
Well, I have kind of been calling around, and just my first experience here, everyone is so kind and so nice. The staff is fantastic. It's very comfortable. They explain everything really well. They do everything that you're not ever like wondering what is going to happen next. It's very it's very guided and good. So I really like it here.
Yeah, it's important to know especially when something like this, especially when you come into it. Okay, so then maybe for a last question, what would you tell somebody who is looking into or thinking about ketamine? And
I think you have to put everything that you might have read about kind of outside of structured treatment environment aside, because it's not the same as doing like a prescribed treatment, and just, you know, I think it's one of those things that you have to try. As somebody that was like extremely serious about my wellness, it was like, well, I might as well try it. Like, what is the alternative? So and I'm so glad that I did. So I would highly recommend somebody to try it, and then if it doesn't work for you, you know, it doesn't work for you, and that's okay.
Exciting. Perfect. All right, well then I think that was perfect.
Awesome.
Thank you so much.
Of course.
I appreciate
That was easy.
you.